account manager for your school district here in the region. And our presentation today is to talk about those value-added services that are available to you as a CISC member. And some of them are at no charge, some are at a minimal charge. Some of those services could save you money in the future. And so we're going to go through and talk about it. But first I want to share a little bit about who CISC is. CISC stands for Self-Insured Schools of California. And we are a joint powers of authority administering benefits in 42 counties throughout the state, in over 440 school districts, and servicing over 330,000 members. And so we are a very large pooling resource, actually the largest school-focused pooling resource in the United States, pooling resources of our school districts together. And by doing so, we can provide services to your school district or to our members, CISC members, or the employees of the school district at no charge. So with that, I want to share, there's a couple services that we can provide to the school district at no charge. We have our Health Smarts Health Improvement Program, which provides the on-site flu shot clinics and the biometric screenings, and those are available and coordinated with your Vitality program that you have. You're very fortunate with being part of the Santa Clara County Office of Education and having a wellness program. A lot of school districts out there do not have a wellness program, so that you're very fortunate to have that, and we partner with them to provide a little bit or a portion of those services. COBRA administration, if you separate from the school district, no longer an employee, federal law gives you the option to purchase the benefits at a group rate or the same rate that the school district's paying for it, and those are the COBRA benefits, and we handle the COBRA administration for the school districts at no cost. And then we have the direct bill for self-paid retirees that we will be administering in the future for them. So they will, if you are retiring from the school district and the school district no longer contributes towards your benefits, we have some options that could be available for you at 100% self-pay, and we can share that with you at the time of retirement. The other benefits that we're going to focus on today are the benefits that are available to the employees. And we have various different benefits, the EAPs, the Advanced Medical, MD Live, discounts for gym memberships, various different ones that we're going to go into detail and talk about today. But this is just a brief graph showing the discounts that are applicable to each of the plans or the enrollments that members are in. Okay, so the Anthem PPO, specific to this district, the Kaiser HMO, Delta Dental, and MES Vision are the ones that are offered here at your school district. So the wellness program, I mentioned it before. You have various different components to your Vitality. The two pieces that CISC supports are the flu shot clinics and the biometric screenings. And we like to share a little bit of information about those those biometric screenings are really important. We really think it's important for our members to know their numbers, to know if you're at risk for diabetes or hypertension or high blood pressure, different things like that. And so by doing those screenings, not only do you get Vitality points or whatever your program provides, but you are armed with knowledge of your own things that you can control. They say that 70% of all diseases are preventable through exercise and diet. And so if you know you're at risk for diabetes, it's important to do something about it. So with this, in 2017, when we looked back, we had 553 members who didn't even know that they were at risk for diabetes. We had 181 that were actually diagnosed with diabetes because of the additional voluntary A1C test that we do for members. So if you come in and you do your screening and your blood glucose is high, and there's a couple elements that they look at, and you qualify, you can voluntarily do an additional test, the A1C test, which is a 3-month look back, and to look at your blood sugars over a 3-month period, and they can tell you a lot of information about what's happening. And so we had 372 that were diagnosed with prediabetes. So this is not just the statistics for SCOE, it's the statistics for all of CISC. But it's important. People walk around and they don't know that they're at risk. The Employee Assistance Program is a underutilized but very valuable benefit to the employees of our school districts. This benefit is actually available to all Santa Clara County Office of Ed employees, not just those employees who are full-time or those employees who are enrolled in benefits. It's available to all employees of the school district, whether you're full-time, part-time, on a medical plan or not. Okay, so this is available to you. There's different components to the program. One of the most underutilized is the counseling benefit. So if you are, if you're having issues with stress, whether it be at work or at home, or emotional issues, or grief, or financial issues, addiction, this program allows you access to talk to an employee assistance program provider at no cost to you. You can get up to 6 visits per incident. And it is also available to anyone who lives in your home. So if you are having a lot of stress, because now you have somebody, maybe a parent or Aunt Mary or a friend who has come to live with you, just as an example, and you're not quite sure how to deal with this new person, in the home, you can call and get assistance, and that would be considered a situation or an issue, and you can get up to 6 visits with a provider. And that can be, telephonic, or it could be in person. And that person who's living in your household can also access the benefit. Call in and they can make an arrangement to get up to 6 visits at no cost. And then let's say 3 months later, your teenage son is, you find out he may be dabbling with drugs or something, has some type of addiction. You can call and get assistance. Your son can call and get assistance. So it's good for everybody in the house. And it's highly underutilized. We call it, the Employee Assistance Program, a life program. The program is designed to make your life easier in any way that you can imagine. There's a lot of different components. So it's something to remember or to refer a friend to, a coworker who's struggling. It might be a good thing to share the Employee Assistance Program with them. There is also other benefits. There's web-based benefits that are available to you. You can get articles, you can do education, there is webinars, podcasts. Every month they send out a monthly flyer and they do a topic on, it might be stress management or managing work and personal life, something like that. And there's things that you can listen to. There's also legal forms out there. There's a whole plethora of a database that has all kinds of things that are available. My Strength is basically a health club for your mind. So you can sign up for My Strength, and there is positive training tools that are available to you. You can design it for things that are inspirational to you. In addition to those services, there's services that we provide to the district. There's management consultation, there's critical incident debriefing or stress management. We've had a lot of school districts access that piece of the employee assistance program. We've had school districts that have had suicides of employees or students. They've had shootings on campus, different things like that. And so the schools have reached out to the employee assistance program, and they've had on-site counseling and trainings. We do webinars. Anthem EAP will come out and do, brown bag lunches or meetings like this, but to specifically address a situation. So those are available as well. There's manager referrals. If you are a manager or a supervisor and you have some questions about how to interact or handle a difficult employee, they can assist you with that. I would also encourage you to work through your HR department on how to handle those employees, but there's various different steps that the managers or the employees can use to refer members, to remind your employees that the employee assistance program is available. There are, there's different levels. If there's a problem, they tell you how to address it, or if it goes further than that, and there's an action that the employee, there's an action that the employee has to take as part of their employment requirement. So maybe attend a substance abuse program or go through some modules where they're learning something. EAP assists with that, and then they print off a certificate at the end where the employee can turn it in to their supervisor or the HR department to show that they did what was required of them. Okay? Any questions about the employee assistance program? There's a lot of different components that are available. I would encourage you to go to the website noted at the bottom, anthemeap.com. Keep in mind, Anthem is just the company that administers the program. Your Kaiser members or employees not on benefits are also eligible for this program. Okay? I gotta watch my time here. Expert medical opinions. This is a program that's available to all SISC members that are enrolled in a medical plan. So if you're on an Anthem PPO or a Kaiser plan, you're eligible for this. This is a program that we rolled out a couple of years ago, and it has been invaluable to the members who have opened cases and taken advantage of it. Basically, this is a program that SISC pays for our members to allow you to have access to talk to a doctor and to ask questions, have access to world-class specialists in the realm or of the condition that you have, and you can actually have interaction with those physicians at no cost to you. We think it's really important that members have the right diagnosis, they're on the right treatment plan, and this program gives you access. No question is too big or too small. You can engage with Advanced Medical either by telephone, by logging in to the website, or logging in, email, login, or telephone. When you sign a consent for them to interact and talk with you, you have a secure account that is set up. It allows you to get a second or third opinion. Maybe a doctor has diagnosed you with something, and it's new to you, and you have so many questions. You know, we only have a limited time with our doctors when we go in to visit with them. And then as soon as we leave, we come up with all these questions. And many people turn to the internet, Google doctor, trying to figure out and answer their questions. And we think it's really valuable that you have a physician to talk to ask those questions. Our membership last year, the average time members spent speaking to a physician was 162 minutes. Where in the world can you sit and talk to a doctor for that long? And it wasn't all at one time. Call in, ask questions, talk about your case, your condition, the upcoming surgery you have, whatever it may be. So you have access to do that. And there's no travel required. You're doing this from the comfort of your home. And what happens with that second opinion is when you sign the consent, that gives Advanced Medical the authorization to gather all your medical records from your doctors, your specialists, the lab, the radiology department, your prescriptions, information on your prescriptions. You will work directly with the doctor. They'll collect all that information. They will summarize it, digitize it, and send it to a world-class specialist in that realm of need. So if you're diagnosed with a rare type of cancer, or you have questions because your son has a rare kidney disease, and that specialist may be back at Harvard or in New York or at UCSF or down at UCLA or in Spain or in another country somewhere else. Well, Spain is another country, but somewhere else. Wherever that world-class specialist is, they will render an opinion. Usually takes roughly about 2 weeks after they get all your records, and you get access to 2 hard copies of that medical opinion, and then you have the electronic copy. You can share that information with your doctor. You can share it with family members. They will set up a conference call where the specialist or the doctor from Advanced Medical can communicate directly with your doctor and explain their findings and why maybe they added a new medication to your regimen. Now, keep in mind, they're recommending. They're not changing prescriptions. They're not doing anything. They're giving an opinion. And then from there, you work with your doctor or your specialist. We have stories upon stories of different members who have used the service and had either a change or a change in diagnosis, because there's nothing worse than getting the wrong diagnosis and going down that road. And, for us, it's not good for our members, number one, to have the wrong diagnosis, but it's also a waste of medical dollars. So members are taking prescriptions, and they could be making their condition worse by a wrong diagnosis. So we want to make sure that you have the peace of mind that you have the right diagnosis. And then from there, you can do with that information what you want. But we had 51% of CISC members who used the service had a change in their treatment. Okay, so something to keep in mind. Again, this is for PPO and the HMO membership, people that are enrolled. Any questions about that? No? Okay.
One quick question.
Sure.
Because they have to access medical records, you can't call on behalf of like a parent or something if you wanted more information.
No,
okay.
No. They're going to match eligibility.
Okay.
We have had many members call. And Advanced Medical will do this on an individual, personal basis outside of CISC, but it's only for CISC members who actually get the second opinion or the review. Okay?
This is not for family members, it's just...
Well, no, if your family member is on the insurance plan, the medical plan, then yes, it's available to them. Yeah, I could tell you guys stories, just horror stories of, a few members that have had a change in treatment or were diagnosed wrong. And but we're not going to go there. So I'm going to start talking about a couple of programs that are applicable to the Anthem PPO members, okay, those who are enrolled in an Anthem PPO plan. And then I'll circle back around to share a little bit of information about Kaiser. Kaiser is an integrated system, and they're kind of all self-contained, whereas on your PPO plan, you're accessing care different places. You're accessing care, from a doctor, and then you're going to a radiology department over, or a facility over here, and you're going to a lab over here. So I'll talk about Kaiser in a moment, but CISC fills in some of the gaps on the PPO plan with some products that are valuable to the members. Okay, so on the Anthem PPO plan, we have a product that's 24/7 physician access. This is called MD Live, and it's available basically for kind of urgent care needs. Okay, the members who access MD Live may choose to do so because it's convenient. They can actually talk to a doctor or see a doctor because you can access via telephone or video, and it's a $5 copayment. The urgent care type services that you may access may be you have a rash, an eye infection, a sinus infection, bronchitis, urinary tract infection, a rash all over your body, different things like that that you would probably want to go to urgent care for. Hopefully not the emergency room, but urgent care. This gives you the convenience 24 hours a day, 7 days a week, 365 days a year to be able to talk to the doctor. How you engage is you call MD Live. They will have an intake person who will charge your credit card a $5 copay. Now this is if you're on the 100% PPO plan or the 80% PPO plan. If you are on the HSA high deductible health plan, because of IRS regulations, they require that you pay from the first dollar of medical expenses, and that goes toward your deductible. So you just have to pay the office visit amount for that service, and it's a $40 copay. That does go toward your deductible. But the other two PPO plans, it's just a $5 copayment. They do an intake, they get the information, and then typically in less than 20 minutes, a board-certified physician or pediatrician is reaching back out to you, however you want them to. It could be by telephone, it could be online video, either from your home computer through a Skype or on your phone through Skype or FaceTime, something like that. And they can diagnose, recommend a treatment, and even call in a prescription for you at the convenience of your home. Okay, so you wake up 2 o'clock in the morning, you're covered in a rash, you can access the benefit. You have bronchitis, you call, they can diagnose and call in a prescription, and you can have somebody pick it up for you, and you don't miss any time at work. Okay? Also, through MD Live, you have the 24/7 online therapy. So this was a program that was added a year or two ago. In many regions, it's hard to find behavioral health providers. So a lot of them don't contract in the networks, so members are paying hundreds of dollars out of pocket for therapy or to see a psychiatrist. MD Live offers that benefit to you. Maybe addiction, anxiety, stress, and you want to talk to somebody about it. You can also use this program, and it's a $5 copayment. They give you a list or the bios for many of their different therapists, and you can choose who you want to have your visit with. Maybe Tuesday night at 9 o'clock is the best time for you to have, weekly therapy or whatever it may be, whatever you're dealing with. You can actually set up an appointment with that same provider. If you don't care for that provider or you don't have that connection, you can pick another one and have visits, okay, for a $5 copayment. If you're on the HSA plan, they will charge the cost of the visit, again, due to IRS regulations. And that cost of that visit for therapy or psychiatrist could be anywhere from $90 to $220, $250, depending on what that normal visit would cost. Okay? Yes?
Is there a limit on how many visits you can have with this?
So the question is there a limit on how often you can use this service? And there is not. Now, I will share that if we had a person whose daughter had chronic ear infections and kept just having ear infections, MD Live will share the information with your physician, and they could recommend that you take your child or whoever it may be, whatever the condition is, that you take them or go in and see the doctor in person rather than continuing to use MD Live. Okay? Okay, this is another program that's available to the Anthem PPO members. I hope if you're on Anthem, you know this. CISC provides free generic medications if you use Costco as your pharmacy. You do not need to be a Costco member to use their pharmacy, but if you do, most generics will be at a zero copay. There is, you can get a 30-day supply or a 90-day supply of medications, depending on your prescription, or if it's a maintenance medication. For the generics will be a zero copay. And there's also mail order service. So if you are on an Anthem PPO plan, you know that the only way to get mail order prescriptions delivered to your home is through Costco. So your generics will be free. If your generic medication is a narcotic, we don't give those away free. Or if it's like a cough medicine with codeine, those will just have your generic copay on your plan. But other than that, most generics are at a zero copay, and your brand name drugs will just be at the brand copay. Okay, yes?
What was the refill? You said it was 40 and 100? Or?
No, you can, if your doctor writes a 30-day supply, you can use Costco, or if the doctor writes up to a 90-day supply. Costco is the only place on our plans that you can get up to a 90-day supply, whether it be at the retail pharmacy or through Costco mail order. Okay? Okay. Another piece that is applicable to the Anthem PPO members, on our plans, if you are having a hip or knee replacement or spine surgery and you're expected to be overnight inpatient, CISC's plans require that you use a Blue Distinction Plus facility. Otherwise, we will not cover the benefit. So that's in the details of your PPO plan. We are offering an alternative to using a Blue Distinction facility to have a hip, knee, or spine surgery. And that alternative is called Carrum Health. And this program actually takes you down to Scripps in San Diego, and you see, qualified surgeons who will be doing that inpatient, and they pay for everything. They coordinate everything. They have a concierge service that will contact your local doctor, orthopedic doctor that you've been seeing. They will coordinate the care, transfer all your medical records down to San Diego. They will pay for you and a companion to go down to San Diego. That could be flying you down, most likely, because you're right here by an airport. Fly you down to San Diego. They'll put you up at the beautiful Hilton, which is right next door to the Scripps Hospital, right on the beach. It's a very nice facility. And you will have your surgery. You will do a little bit of time recovering depending on the surgery. And then they will send you home, transfer everything back to your local physician. And by doing this, there is no cost to our members, no out-of-pocket expense. All deductibles and co-pays and co-insurance are waived unless you're on the HSA plan. Government requires that you meet your deductible, but anything above your deductible with regards to a hip, knee, or spine surgery and using this program, they will waive it for you. So if you have one of those surgeries coming up, you may want to call them just to get information and consider it. Okay?
Question for you.
Yes.
What if I'm having Kaiser and I'm on an HSA plan, high deductible plan, and then I need to have a surgery? So can I change my plan like this month, in August, so that I can get this?
August is the open enrollment period for a change that goes into effect October 1. So yes, you could move from Kaiser during open enrollment to the Anthem PPO plan, and you'll want to look at the benefits and everything that goes along with that. Mm-hmm.
Another question.
Yes.
I'm on the Kaiser, but the DHMO, so would I go to just regular HMO?
If you are on a Kaiser plan and you need a hip, knee, or spine surgery, it's going to be within the Kaiser realm. This program does not apply. Okay, this is only for, in the little gray boxes on the presentation, it tells who it's applicable to.
Oh, no, also if I was to change.
Oh, if you were to change.
Because I'm under the DHMO right now.
Mm-hmm.
I noticed that there's only 2 under Anthem. So which one would be the closest? Some of the deductible HMO.
It depends on the payroll deduction. The question was which plan from the Kaiser DHMO over to the Anthem PPO plans, which would be similar. They're totally 2 different animals. And so I would encourage you to look at the differences. The Anthem PPO plan, 100%, I don't have that plan, may have a lower deductible than the 80% plan, and then the HSA plan would have a very high deductible. So during open enrollment, I think we're having an open enrollment meeting August 5th in this room, in the Saratoga room at the County Office of Ed. And if you have questions or need benefit summaries that you want to take a look at, please join us then.
Anthem and Kaiser will be here. So
Yes.
they can answer all those questions.
Yes. Okay. So this is for Anthem PPO members, an alternative hip, knee, and spine surgery. Also, all these programs that I'm talking about, we have flyers that will be available. They'll either be on the website, the district website, or you have access through the CISC website for these different programs that give a little bit more detail. Celera is a program that's for diabetes prevention. And, for years, the medical plans always had a program that were available to you if you were diagnosed with diabetes. But there's a lot of us that are sitting on the fence about, with pre-diabetes. And we want to know what to do to keep us from going over the other side of the fence and being diagnosed with diabetes. So the government passed some regulations that require the health plans to have a pre-diabetes program, which provides you a 16-week program that teaches you healthy eating, healthy lifestyle. It incorporates exercise and things like that. And there is a whole bunch of different companies that you can access and use for that 16-week program. It could be a Weight Watchers program where you go in once a week and you attend a class and you weigh in. It could be a digital program where you're working off of your phone or your computer and you're logging in. They have available to you fitness trackers, and they can give you a digital scale, and it will automatically record your progress and what you're doing. There's companies, Weight Watchers and Loon and Health Slate, Skinny Jean. There's a whole bunch of there's a list of providers that you can engage with. And this is at no cost to you. It's a wellness program to try to get you to adopt healthy habits to keep you from going over the fence and becoming diagnosed with diabetes. Now, Kaiser has a similar program. It's a pre-diabetes program with education and things that they do through Kaiser. Okay, Celera, for me, is actually for the Anthem product. You have access to discounted gym memberships through Active and Fit. This is a program that's available to Anthem members as well as Kaiser members. Both companies contract with Active and Fit direct to provide you with access to contracting gyms for a $25 a month fee, and then there's a $25 enrollment fee. There's different gyms that are contracting. Some of the gyms in this area are City Sports Club, Fitness 19, Curves, Right Stuff, Fit Republic. I know that they contract a lot with the YMCAs. If your gym is not currently contracting, you can go to the website and you can nominate your gym. And the company that administers Active and Fit will reach out to your gym to see if they can be part of the program or join the network. And then keep in mind, there are some gyms that offer membership that are less than $25. So this would not be the avenue for you, but it is available to take advantage. And if you're already a member at some of these gyms and you're paying $50 a month or $75 a month, I would look into Active and Fit and see if you can change that to the $25 membership. Okay? So, moving into a different realm now. Yes?
I have a quick question just about the next few slides.
Uh-huh.
We don't have our dental or vision insurance through CIS.
Right.
Okay, it's okay.
Right. Yes.
Okay.
So I want to share that. This is a different, when I say it's a different realm, I'm just sharing the value-added services and benefits that you may not be aware of. Again, as Sherry said, Delta Dental and MES are not through CISC. The school district purchases it through a different avenue, but the benefit is still there for the Delta Dental members. So this particular item has nothing to do with dental, but because you're a Delta Dental member, you have access to discounted LASIK eye surgery.
That is so weird.
I know. It is. But you're not aware of it, are you? So that's why I want to share that information. So QualiSight LASIKs, if you, because you are a Delta Dental member, that provides you access to 40 to 50% discount on LASIK surgeries. Now, keep in mind, Anthem, if you're an Anthem PPO member, they have access to a lot of different discounts as well. So through them, you can get a discount for LASIK surgery, discount at Weight Watchers, different discounts that are available because you're an Anthem member. But for our Kaiser members, Kaiser wraps their arms around you and provides everything that they can for you. Kaiser is a all-inclusive, but they don't offer LASIK eye surgery or discounts for it. So if you're a Kaiser member and a Delta Dental member, this is an avenue that gives you a discount. Okay? And your dental provider also gives you discounts for hearing aids through Amplifon. So Amplifon has a network of providers. They offer savings up to 62% off of the retail hearing aid price. And if you are an Anthem member, you have a $700 hearing aid benefit. You can kind of coordinate that with this Amplifon benefit and save yourself some money. Kaiser members, you have a small, on the HMO and the DHMO, you have a small hearing aid benefit through Kaiser. I'm not 100% sure if you can coordinate that with Amplifon or not, because I think Kaiser uses their own providers. I think it's Hear USA is who they use, and I don't know if Amplifon contracts with Hear USA. Out of my realm, but it's worth looking into to see if your existing benefit can coordinate with the Amplifon benefit as a Delta Dental member. And then, to further piggyback on that, if you are an MES Vision member, you have access to discounted hearing aid benefits. Yeah, or hearing aid discounts, excuse me, up to 60% because you're an MES member. So the way I look at this is if you're a Costco member, you know, Costco sells or advertises auto insurance and different things because you're a Costco member and you get those discounts. I look at it as Delta and MES doing the same thing. Both Delta and MES have a tremendous amount of membership. So these companies contract or make themselves available to the members of those companies and provide those members discounts. Okay. Make sense? Okay. So available resources. Your district, as I mentioned, will have flyers. We have individual flyers for each one of these programs that gives you a little bit more information. I would also encourage you to visit the website for each of these programs. They have short 2-minute videos and testimonials and information about how the programs work. And then also you can visit CISC's website to get these resources. So I do want to let you know that we appreciate you being a CISC member. And I do want to share just a little bit about Kaiser. I know many of you are Kaiser members. So I want to no. I'm sorry. Give me just a half a second. I apologize. I had it pulled up and now it's disappeared. With Kaiser, as I mentioned before, they are all-inclusive. Oh, Lori. There we go. So we talked about MD Live and talking to your physician and getting information with your Anthem PPO plan. Kaiser is all-inclusive, and they provide those types of services as well. So with Kaiser, it's an integrated system. So whether you're accessing care mobily, by a laptop, you're going in and visiting your physician, you're emailing your physician, you can do all those types of access to your providers through Kaiser. But Kaiser also offers those options to see all of those, you know, to communicate with a surgeon or a nurse or a pharmacist. And those are available in many of the same ways. You can, save a trip and do a phone call and talk to a nurse or a physician. You can do video appointments, schedule face-to-face visits, which are so convenient. And I know that's really big in the north. It's not as big in the south, believe it or not. With Kaiser, Southern Kaiser and Northern Kaiser are two separate companies. And Northern Kaiser is a little bit more advanced in that aspect with those video appointments with your doctor. You can connect with a care team via an email. So you can shoot off an email to any one of your doctors or anyone who manages your health care. I've done it recently for my father and have communicated back and forth with his doctor. And let me tell you, that's a very nice feature that Kaiser has to offer. And then kp.org has a lot of information. Also, they can bring specialists into the office. So phone appointments are a convenient way to get your routine care with Kaiser. Primary doctor appointments or specialist care, you can schedule your follow-ups and do phone appointments. I know my mom is diagnosed with diabetes, little personal information here, but she does every 2 weeks, she touches base with the pharmacist and her care team to go over her numbers and they track her. So that's available to you. Also video, having those video appointments. So if you're on Anthem, you can do video appointments with MD Live for $5. Under Kaiser, you can do video appointments. And I don't believe there's a cost with Kaiser at this time for those video visits with your healthcare providers. And then again, email. The convenience of emailing your doctors is a really nice feature that Kaiser offers that you don't necessarily have with your providers under the PPO plan. And then doctor-to-doctor consults. So you can go visit your primary care doctor. They can bring in a screen, and you can have a consultation with a specialist, maybe a dermatologist or something like that, through Kaiser. So Kaiser has a lot of those features that are available to you. So some of those benefits are value added because they're at no cost to you, provided either by CISC or one of your other carriers. And I'd like to know if anyone has any questions. No? Good, good. I hope everyone learned something today. Please, if you have questions, let us know. Grab flyers, visit websites. I do encourage our members, no matter what program you're on, if the carrier has a website, register at that website, whether it be Anthem or Kaiser, Navitus Health Solutions, which is your prescription drug benefit along with your PPO. There is a lot of information out there that members have access to, and they just don't take advantage of it. Okay. Thank you so much for giving us your time and attending this meeting. Have a good day.